Staki mbwembwe na kwele mchele kwa kuku kumwaga. Zako na wapenda haya tusema nitasikia.
Hello, my name is John Vermeulen, and I've been asked by the Unite the World and Africa Foundation and the Unite Scholars and Mentorship Program to provide a brief video pertaining to what led me into the healthcare profession and why I'm grateful that I chose that path and why I would recommend it to others. So, I've always had a very strong interest in science. How things work have always fascinated me, and that led to pursuing a possible career in chemical oceanography in my college days. But fortunately, family and friends convinced me to also consider a possible medical career, which I did. And as I learned more about the possible medical careers that could be available and their benefits, I switched my approach from oceanography to medicine. And subsequently, I became very thankful and grateful for that. It's been a very rewarding career. So, briefly, it can be a long process depending upon what area of medicine you enter, but it's a fascinating process of learning. For me to become a physician, I went through the usual progression of medical school, internship, residency, to become a practicing internist. Along the way, though, I became interested in the digestive tract and diseases of the digestive tract. So I went on to take another 3 years of education and training in gastroenterology fellowship. And that led to a brief period of medical teaching, academic research, administrative work, but ultimately led me into a 25-year career practicing clinical gastroenterology, which I highly found rewarding, very rewarding to me. So I'm since that time I've been retired, but my background has facilitated volunteer medical teaching in such countries as Cambodia, Bhutan, Vietnam, Uganda, Tanzania, and lately as a Fulbright Scholar, I did some teaching in Malawi. That was cut short by the COVID-19 pandemic, unfortunately. So why did I pursue a career in medicine, and why would I encourage others to pursue a similar pathway? Well, briefly, first of all, a healthcare profession provides so many diverse and numerous possibilities, from becoming a technician to a physician, a nurse, a researcher, a dentist, a pharmacist, many others. Very importantly, there are positions available for all education levels as well. Secondly, it tends to be a very stable area of employment with high job satisfaction rates, high job security, flexibility. It's a career that tends to be very engaging. There's rarely a dull day. And that's partly due to rapidly advancing medical science and technology, but also due to the fascinating complexity of human interactions. Finally, and probably most importantly, a healthcare career provides a chance to make a big difference in the well-being and quality of life of your fellow human being. It's an environment where you interact with fellow human beings in a tangible and compassionate manner, and you do it on a daily basis usually, and that's very highly motivating and rewarding. So in summary, I encourage all, even if you have a small interest in healthcare professional work, to very seriously look into it, to explore the possibility further by talking to those in the various healthcare professions in your local area to see if it's a career you might want to pursue. As you learn more about it, it can be very rewarding, stimulating, multiple benefits, and multiple benefits importantly to your fellow human beings. So thanks for listening, and I encourage you now to go out and explore the various healthcare career possibilities. Best of luck to all.
Nanipaga moyo nikianza kulia chozi nafutia.